Hello and welcome to In the Diaspora on Wide 99.9 FM with me, David Chisanga. In the Diaspora is a weekly radio program that focuses on Irish migrants. The program follows the lives of people living in Ireland who left their home country either for work, study, business or asylum. Today, we focus on Karen Tatenda Kamukapa, a medical doctor from Zimbabwe. She's been in Ireland for about 4 years. Hello, Karen, and welcome to In the Diaspora.
Hello, David. Thank you for having me.
All right, so I'm going to put you on the spot as we begin. First thing first, what does your middle name, Tatenda, mean?
Well, it's a very common Zimbabwean name. It means we're grateful. Thank you, Lord, basically.
So what are you grateful for then today?
For life.
Life in general.
Just life in general. To be here, to be breathing, that's just a gift in itself.
Now, Karen, we know you are a medical doctor by profession, would you now tell us more about yourself? Who is Karen? What does she enjoy doing outside medicine or within medicine?
That is such a broad question, but I'll try and narrow it down for you. So I'm the first of 4 kids, so firstborn vibes. And I've always wanted to do medicine ever since I was 10 years old. So I just knew, that I was going to do medicine. And I know at that young age, it was just seeing the poor service really at a local clinic when I'd gone with my siblings to the clinic. And I just had this stirring in me to be like, one day, you know what, I need to grow up and make a difference. So that's kind of how it started. And, here we are doing medicine, doing what we love. Outside medicine, I enjoy talking a lot and singing.
You actually speak well, by the way.
Thank you very much. Thank you. And singing, I'm a very creative person. So I enjoy writing, dancing, although I just dance by myself. I do enjoy dancing and just nature and traveling. I love food. I'm a foodie and I love helping people. So volunteer work as well is close to my heart.
You spoke about singing, right? So I'm going to put you on the spot again. And I'm going to ask you to sing a bit of the national anthem, the Zimbabwean national anthem. Would you give us just a sample of it?
Wow.
Let's go, Karen. Don't be shy now.
No pressure. So our national anthem is actually sung in 3 different languages. So in my brain now, I'm trying to pick which language am I going to sing it in. So I think I might go with the Ndebele version. Okay, here we go.
Let's go.
Pagami sani flag, yetu ye Zimbabwe, eyaza lwangempini yenkululeko. That's a bit for now. The lyrics are running away.
Well done,
now
Karen.
that you put me on the spot.
Well done.
I hope no Zimbabweans are listening right now. Forgive me.
That's so beautiful, really. And, you sing very, very, very well. And now, speaking about Zimbabwe, would you tell us a little bit, just one fun fact about Zimbabwe? We understand it's in Southern Africa. We also understand that, it's next to South Africa, Zambia, if I'm not mistaken, Botswana, as well as, is it Mozambique on the other side?
And Namibia as well.
And Namibia. So you have several neighbors as well.
Absolutely. We're a very friendly country.
Are you landlocked as well?
Absolutely landlocked, yes. But we do have the mighty Zambezi, which leads me to what we Zimbabweans claim to own the Victoria Falls.
That debate between you and Zambians will never end.
We're one people, Rhodesia, so we both own the Victoria Falls. I'm a diplomat, sir.
Is that a fun fact about Zimbabwe or not?
It's one of the 7 wonders of the world. So, yes, it is a fun fact. And the name Zimbabwe came from the ruins in Masvingo, which the name was Zimbabwe, meaning houses built of stone. It's actually a wonder in itself because it's stones laid together, the architecture. There's no mortar there. There's nothing holding it. There's no cement, but they're still standing centuries later. Just shows their geniusness of the Zimbabwean people. I mean, tell me a Zimbabwean person who's not smart. Like, we are just gifted and super smart people. So, yeah, that's a little bit I can say about Zimbabweans.
That's a fun fact. Can people go to the Great Zimbabwe?
Yeah, it's a huge tourist attraction. I've been there a couple of times myself. It's really beautiful, and it just shows you the history of Zimbabwe, where it all started, the kingdom of the great Zimbabwe, everything. Yeah. So that's a pretty cool place to go.
You're listening to In the Diaspora with me, David, and I'm speaking to Karen. She's from Zimbabwe, and she's been in Ireland for about 4 years now, and we're just getting her story as well, and she's a medical doctor, pretty much, and how she's doing. Now, walk us through the journey, of how you came to Ireland, what prompted you to even come to Ireland in the first place?
Well, I never really planned to move to Europe, let alone Ireland. So I studied in South Africa, and I had this 25-year plan, finish med school, do my internship, specialize. I was going to become a surgeon and part-time lecturer because at that point I really enjoyed teaching. Then I was going to retire, and run the WHO. That's still a work in progress. We haven't checked that out. But I finished my internship, and then the xenophobia started in South Africa. So they would not allow non-South African doctors to practice. Even if you studied in South Africa, you're well acquainted with the health system, they would not allow you to work. So I and many other doctors, it's still happening even till date. We were unemployed for the first 3 months, whilst the rest of our classmates had already started internship. After fighting with the Ministry of Health, we got our internship. And then after that, we still couldn't do our medical officer role. So the thing is, in South Africa, once you finish internship and you become a medical officer, then you're now an independent practitioner. Yeah. So now, if you're not an independent practitioner, you cannot work. So it's like all those years of med school, just down the drain. So I was unemployed for 18 months, still looking for a job and nothing. That's when I had to look elsewhere. So obviously, like many other people trying to migrate to UK, Canada, those were options, but those required extensive examinations, very pricey and all that. So Ireland had its arms wide open. They're like, we want healthcare professionals. Yeah. So it was really easy to migrate here. All you had to do was just write an English exam. And with my South African degree, it was easy to just, get it transferable to the Irish system. And that's how I ended up here, really. I didn't choose Ireland. Ireland kind of chose me, in a sense. And being here, I landed in a rural town, Letterkenny. Very beautiful, but very remote. And obviously the culture shock, and the difference in the healthcare system, really. It was a public hospital, overcrowded. But, coming from Africa, we used to, being overcrowded and overworked. So essentially, that's how I ended up here. And then I decided to explore private options. And then I ended up working for a minor injury clinic. And that's where I am till date.
So now, what was the cultural shock, really, for you when you arrived here in Ireland?
Well, firstly, you would think they speak English, but I could not understand what they were saying. So that was a start. And just in terms of respect, really, in Africa, the profession is very much respected. Whereas here, if you're of a certain color and if you're female gender, obviously you have to prove yourself even more. Like you have to work twice as hard and they will not really listen to you. Whereas back home, of course, there are still those people that that would disrespect you, but they would still respect you just because of the role that you're in, And I found that really lacking here. And here it was more of defensive medicine. So everything you do is to be like, okay, just in case somebody sues me one day, I have to be covered. Whereas back home, you're practicing without that, concern that, my gosh, somebody's going to sue me. So you're really focusing on the patient. It's more holistic. And I think we spent more time with the patient as compared to here. It's more like everything is timed, in and out. So that's the big difference that I found,
That you actually, observed. And now, how did you feel, when you arrived at Dublin Airport, for the first time, really, from Zimbabwe? Because you were in South Africa now, from Zimbabwe, how did you feel, really?
Stressed.
Oh, okay.
It was scary. I mean...
Stressed?
Because it's stepping into the unknown. You've left your family and everything that you know. And for me, this was a fresh start, because I had already settled in South Africa. I was like, this is me. The next 5 years, I'm here. And then having to leave everything and just bring my clothes. That's it. I had nothing. And to start all over again. So it was a difficult moment, really, to be like, okay, I thought I had started to establish myself, and then now I'm back to square one and I have to start again. Yeah.
I wish we had, we could go on and on into that, but, for now, we're going to leave it there. And, you came to Ireland and you found the country. Now, this is one of my favorite questions on the program, Mention 3 things that you like about Ireland, and we'll be counting together. So we'll start with number 1.
Their history. They have
the
many
history.
historical buildings and museums and monuments, and I love that type of thing. So yes, they have a rich history and culture.
Number 2.
Number 2. There are no snakes in Ireland. Oh my gosh. Yes. I do not like snakes. So that is great. I don't have to worry about snakes at all. And the third thing?
Number 3.
Number 3, that's a bit of a tough one. They're friendly. Yeah, for the most part, they're really friendly. Coming from South Africa, where racism was just like in your face. And then here, I mean, of course, nobody's perfect, but it's not as bad. They might be here and there, but it's not in your face, So that's nice.
So we said the history.
Yeah. No snakes.
There's no snakes. And then the third one is no racism, so to say. Or
No, it's not in your face.
yeah, not in your face kind of
Exactly.
racism.
Yes, you're free to be yourself, really. I think that's what I like. You go about your business.
You're listening to In the Diaspora with me, David, and I'm speaking to Karen. She's from Zimbabwe, and she's been in Ireland for about 4 years now, and she's a medical practitioner. And pretty much you haven't missed much, We've just been talking about the favorite things she likes about Ireland, the top 3 things. Now, we understand that, Zimbabwe has beautiful culture, and, it also has different people, there. And, we also know that Ireland equally has its own unique culture. Now, what will be some of the similarities, between the Irish culture and the Zimbabwean culture, And what will be the differences, therefore?
Wow, I think I might start with the differences. We're more communal.
All right.
Back home, children are not raised by just their parents. It's the whole village, essentially. The whole village can discipline a child. Whereas here, it's more just the parents and, they're not very communal. It's very isolated. We're very religious back in Zimbabwe. And that's not really the same this side, In terms of similarities, I really don't think we have much similarities, to be honest, because we love good food in Zim. No offense to the Irish, we could use a little bit of some flavoring,
But wait a minute. I don't understand. What do you really, really mean there?
The flavors are a little bit lacking. We love our Roykos from back home, our Robinson spices, Yeah, we love our braais, our gotch. That's what we call it. So that's kind of missing here. Yeah.
All right. So let's delve into food then, since you've mentioned food. So what would be an ideal Zimbabwean lunch or an ideal Zimbabwean breakfast?
We'll start with breakfast.
Grand.
So we have our bread with some baked beans that have been cooked in a tomato sauce with onions and tomatoes, with some eggs, and then your country-style sausages. That is the best. And then a really strong cup of tea with some milk.
Why did it have to be strong cup of tea?
Oh, it's nice and strong. You really let that tea bag brew, and then you put the milk. It's not just dip and dunk and leave it out. No. It's really got a brew in there. So, yeah, I can almost taste it.
I know. I know. And wow, let's go to lunch.
Lunch. We're not very big on lunch, to be honest. So people could have anything, burgers, fries, which is not really Zimbabwean, but that's what people do. Or in the more traditional homes, it would be like sadza, which is pap, which is nshima in other languages, with any stew, really. it's not really set. Like this is what we would have for lunch, and then people normally have tea at 4. Yes, we were previous British colonies, so we need our tea at 4.
Yeah, you need your 4 o'clock tea, you know.
Yes, and that has to be with some bread, with jam and peanut butter. That is a staple. Absolutely delicious.
All right, so you said peanut butter and jam
It is a good combo. Try it.
on the bread?
Yeah, one side has the peanut butter,
Yeah.
the other side has the jam. Not just any jam, sun jam from Zimbabwe, by the way. That is the best.
You're listening to In the Diaspora with me, David, and I'm talking to Karen. She's from Zimbabwe and she's been in Ireland for about 4 years. She's actually a medical practitioner. Now, coming to, I know we started talking about your practicing, in Ireland and, and your experience partially you shared with us, but would you now delve more into your experience working in a foreign land, as a woman pretty much in the medical field? How's been your experience over the years,
A bit of ups and downs, really. I mean, on the positive, you're in a first world country, so we have so many resources and, it's a better facility. So that's been great. Whereas in Africa, sometimes you'd have to improvise on certain things just because you don't have stock or something like that. So it's been great being in an environment where things, where you have things that you need for what you need to do, like procedure-wise and stuff like that. The downside has been the quality of the service. I don't know, I may be biased, but in my opinion, I feel like the quality of service back home is better as compared to the Irish system. They may have resources, but the quality is a bit lacking. The waiting times in the emergency departments are ridiculous as compared to back home. And I'm pretty sure the locals can attest to, how atrocious the waiting times are. And then in terms of being a woman, especially a woman of color, it's been the lack of trust from the patients sometimes. So you have to give backing evidence to be like, okay, this is what the policy says. This is what the guideline says. This is why I'm treating you like this. Whereas I don't think they would question somebody of a different gender, of a different color. And so that's been, the one struggle. You have to prove yourself constantly, and just the lack of respect, really, the way people talk to you sometimes. It's just like, okay, like, who are you? And, you've introduced yourself and they're still asking you, where's the doctor? You're wearing a name tag and it's saying doctor. So it's just those small things, that are just like, not so great. But on the overall, I've met a lot of interesting people from different cultures. We're all here to, start a new life. And it's been great learning about the different cultures and also their adventures and their stories, in terms of healthcare. So in a sense, I'd say being in Ireland has really opened my mind to, possibilities of how healthcare systems should run. Because I've had the experience of being in a third world country, now in a first world country, working in the public sector and private sector. So it's really opened my eyes to what can be changed, what can be worked on.
Now, you mentioned something about lack of respect. And how do you handle it then? How do you deal with all these downside issues,
Well, it's just, you just have to be professional and there's limits to it, So as long as the person is not being aggressive, we've had a few cases, or, as long as I'm not in danger, you can just manage it, just really ignore their, the attitude and look at the person. It's all about helping, really, at the end of the day. Like, okay, this person's unwell, so that's what I'm going to focus on, and we will forget the attitude for now and deal with what we have to do. So we see a lot of people, so I can't be running with my emotions, really. So I have to put that aside. Fine, I'm offended, great, but, it's about the patient right now. We'll debrief, breathe after this case and come back and do what we need to do. But we have, spoken up. I think that's one thing about me. We have spoken up about it, and we have signs in place in the workplace, to say, please be mindful of the attitude and atmosphere you bring into this place. Because banks and supermarkets, they have signs all over to say, you cannot disrespect the staff and whatnot. So I really felt that it wasn't right for that to not be in a medical setting where people feel entitled to just insult people that are just trying to help. So I'm glad, that we have these measures in place, so even if someone is being disrespectful, you can tell them in a nice way to be like, could you be a bit more nicer? Could you be at least professional, cordial, so we can, do what we need to do at the end of the day. It's nothing personal.
Indeed, it's everything professional, pretty much, And now, what would be your advice, or in other words, how can I ask this, how would you like the health system then to be here in Ireland going forward, What advice would you give? Is it the state or, those in government, how the system should be run?
Oh, that's a long, long answer, but I'll try to keep it short. Firstly, I'd say there's lack in their primary healthcare system. So that includes the GPs. It's so difficult to get a GP appointment at this point. They're fully booked and they really need to open up more practices. And I think it's an issue of that the older generation of GPs are retiring. And then as much as there's new graduates from medical school, they're leaving the country. So you're not really retaining doctors, but you're retiring most of them. So I'd say having more primary care centers that will cater for the bulk of the emergency department presentations and opening up more emergency departments. Because I know looking back at the history of Ireland, they tried to open centers of excellence where everything would be done in one center, which is a great idea. But then I'm not sure. I don't want to accuse or anything. I don't know if they factored in that there's population growth. We have migrants coming in, we've got the local population increasing. So at that time, maybe it seemed like a great idea, but right now it's not really catering for the population at hand. So opening more centers, decentralizing things might help, or maybe having one or two really super specialized centers in each county, great for those complicated cases, but decentralizing, I think, would help. And one thing I think, might help would be in South Africa, they really utilize their interns and their junior doctors in the sense that they give them more freedom to practice. Like we could do so many procedures as an intern, obviously under the guidance of your supervisor and stuff like that. And we wouldn't put the patient's life obviously in danger. Whereas coming here, even after I am very competent in all these procedures, I can't do them because I'm not a specialist. So you get these minor procedures that could really be done by GPs, junior doctors, waiting for a consultant. But then how many consultants do we have in comparison to the population? So that's why you have all these long waiting times for different procedures and stuff like that, because it's super specialized. So in terms of making more people to practice, get more people to specialize, but also try to decentralize most of these things and allow, as long as they're competent and licensed to do it, I think, people should be allowed to do these procedures without putting the patient's harm's way.
This is In the Diaspora with me, David. I'm speaking to Karen. She's actually a medical doctor and she's from Zimbabwe. She's been in Ireland for about 4 years now. As we near the end of the program, let's go back to your home country and just tell us what you will miss the most or what you actually miss the most from Zimbabwe.
The weather.
The weather.
We have beautiful weather in Zimbabwe.
There's lovely weather in Ireland.
The sun is always shining gloriously on this melanin. I think I miss the sun. Ireland is great. It's green, but it is wet all the time with no sun. So it's the weather, and I grew up in Victoria Falls. So I miss the nature, the wildlife. Freely available. You don't have to pay for it. You're walking in town. Oh, the elephants are in town. You got monkeys and baboons on your rooftops most of the time. So I think I miss that, whereas here you'd think of going to the zoo to see animals. So yeah, the weather and the nature.
And the nature.
And the sunsets. We have amazing sunsets.
All right. Anything else you'd like to share with us about Ireland or about Zimbabwe?
No, I think I've said more than enough.
All right. No, thank you very much for being with us in the diaspora today, Karen.
Thank you so much for having me.
Well, you are listening to In the Diaspora. That was Karen Tatenda Kamukapa from Zimbabwe, and she's a medical doctor. She's been in Ireland for about 4 years now, and thank you for listening as well. Until next time, I'm David Chisanga. Bye for now.